Okay, so people who come regularly will have heard me mention this project in brief before, give updates. I think this is the first sort of more full-on presentation I've done. It's a very large project. It's 2.4 million over 3 years from the AHRC UKRI. It's actually joint funded by the Medical Research Council as well. And although I'm based at ARU and I'm the PI, we are working with two other universities, and I'll briefly skip over our community partners and universities in a bit. But in total, we've now got about 37 partners. So it's turned into a really massive project. And it is what it says on the tin, sort of, co-producing transferable delivery models to support refugees, asylum seekers, and migrant populations. And just briefly, when we say migrant populations, probably my eyes were bigger than my stomach, as my late mother would have said, because we actually thought it would be good to have comparative groups. So in each field site, we've also brought in people who do not have refugee or asylum seeking status. But on to the next slide. So what are we aiming to do? Essentially, we want to generate this sort of evidence-based co-design conceptual framework. I mean, that's direct cut from the applications we put it in. But really what we're talking about is working together with a range of partners, stakeholders, and community members, people with lived experience, to find out what actually works in terms of supporting health and well-being. And as I'm sure most people know, there's this big drive at the moment to actually use community assets more effectively. And I think that's particularly important perhaps in the east of England, because in London, where some of our field sites are, as you'll see, things are a lot closer together. So we're working both locally and regionally and nationally. We had to identify a number of key themes, because I mean, otherwise this could have just got so massive it became impossible. And we looked at accommodation, food and nutrition, and access to support services, which includes health services. We co-designed this right from the beginning, so based on our extensive networks within the universities who are partners and our collaborators and prior work we've undertaken with refugees and asylum seekers. So we knew what were the key issues which were emerging. Support services is obviously massive, and as I said, health is one element, but we also touch upon things such as ESOL, legal services, for example. And I'll start to tell you a bit about what we've been doing in the last 2 and a bit years. So I said it's a very large study, and as you can see, we've got 12 field sites, of which 8 are in the east of England. So we're ARU are leading on those, and our partners in Middlesex are looking after 2 sites in North London, which I actually live in North London, so I actually live near one and have to travel to the east of England sites. And then we also have Greenwich University, our partners, working in 2 South London field sites. So although it's one sort of urban curve, I can't remember what the word is, it's an enormous urban setting in London, we've got a lot of regional we've got differences within different sites depending on the actual populations, communities, and the ICSs that people are members of. So we've run various sites there, and you will note that we've gone for urban, we've gone for, I suppose, Peterborough is semi-rural, Braintree, which I'll talk about briefly in a minute, which is actually Wethersfield, which was, when we started, the only large-scale quasi-detention centre for asylum-seeking men. Now, there's obviously been others that just opened recently, but that was the large one at Braintree, which is Wethersfield. And then we've got the very interesting coastal sites, and you may be aware that they have both changed political complexion since May. So Great Yarmouth is now completely restored UK, and Lowestoft as well. No overall control, but there is quite a lot of reform type influences as well around there. We also have Greens and Labour. So really interesting combination of sites. Here are our community partners. These are people who are named on the bid. So you see there's a wide range of community partners in each of the areas. We also have a range of other sort of collaborators who work with the key partners too. And so it's become larger and larger. So for example, we'll mention New Citizens Gateway, who work with the Iranian community in North London. There's also other groups who use their premises. So we're actually feeding in and collaborating with all of these partners. Okay, so this is the interesting bit. Who are we working with? We said in each field site, other than Wethersfield, which because it only takes single men who all come in on small boats, we couldn't treat it the same way. But in all other field sites, we have 4 key groups: Syrians, Afghans, Ukrainians, and Hong Kongers. Now, Hong Kongers wouldn't necessarily see themselves as refugee or asylum seekers, but they have come in under one of the schemes, as have the other 3 key groups predominantly. Then in each area, as I mentioned, we decided would involve 1 EU and 1 non-EU population to see about people's experiences as well. And you can see there on the right that we have a list of people we actually hoped to identify, so Bangladeshi, Portuguese, Ethiopian, Sudanese, Indians, Iranians. I probably should actually have added that against each of the field sites. But in practice, we've acquired quite a lot more people. So some people have got 3rd country passports, for example. And you'll see there we've got quite a large list of people who have self-identified who've joined us in addition to our 4 key groups. Now, having those 4 groups who've come in under different schemes is really important in terms of legal rights, access to housing, and in practice the type of support that people can access when they are relocated. And obviously the men in Wethersfield have come in very different, they're undocumented, some in then are applying for asylum, some are successful, some are not successful. Some people will then be dispersed quite rapidly. Others are remaining on site longer. At one point, it's technically licensed up to 9 months, but that's now increasingly really speeded up the decision or being dispersed. So we're looking at around 4 to 5 months, I understand, at the moment, most recently, people to move from Wethersfield. So here we are. This is what we've been doing so far. Give me a nod if I'm out of time as well, because I could just go on for ages about this. Or speak, because if I'm looking at the big screen, I won't necessarily see you, Rakesh. So we've trained 21 community co-researchers across our field sites, and they have 10 mother tongue languages. And some people actually have, multiple languages, but these are what they identify as their core language. And so we have a mixture of genders, but we can't obviously, with all of these large numbers of groups, cover everywhere. So we will do loans potentially. For example, if we have an Afghan women's group, as we had in one of our field sites in east of England, we would borrow someone from London because we just don't have, Farsi, Pashto-speaking, women interpreters or translators, community co-researchers in our field site, and vice versa. We can lend people who've got other languages. We've completed 85 walking interviews. So the walking interviews are, precisely that, going out with someone, saying, talk us about the area, the resources you use, how do you access it, what are the barriers you experience, what are the good practice, and take photographs. We've also completed a number of one-to-one interviews. Now, we hadn't intended to do this because we set this up as community forums where people came together and used creative methods, because the call involved using creative methods to capture this data, as well as more traditional ones. But we ended up doing additional one-to-one interviews where we actually felt it was the best way to, drill down further. So for the Wethersfield residents, and we've also completed 4 with people who were there, who've now moved on and kept in touch with us. We've done phone or face-to-face interviews to talk about experience. I mentioned community forums. Right, so there should be 144. As I said, my eyes were definitely bigger than my stomach when I wrote this. And so 12 in each of the 12 field sites. We've completed 72 so far, and what we've done is we've collapsed some together. So because the men from Wethersfield also use Colchester resources quite a lot, we've been holding Colchester and Wethersfield, some of those community fora together, for example. And we have had some targeted specifically at stakeholders, and most have actually been with community participants with lived experience, and those are facilitated by our community partners. So in community forums, largely 2 to 10, 1 or 5 with the stakeholders, we've had 988 participants so far, and that's 620 unique participants. So we do find we get a drop off as people get their decision to some extent, but certainly in some of the East of England sites, we've had people coming back and bringing friends and relatives with them and saying this is really good. We've also been working with a professional photographer who's been capturing our events and community assets. So far, she's worked in 9 sites. Actually, it might be 10 now. She might have done 10th one last week. And that's capturing the creative methods we've used, but also looking at the actual assets which are identified through some of our discussions. So it could be, for example, a community market that people go, here I can get really good food, but it's not possible to get in local shops, or I travel to this X area and there is an Afghan community, for example. And as I mentioned, 1 and 5, the 1 was the introductory one, and 5 was with stakeholders. 12, we've just held one community forum, 12 so far, which was 2 days ago. I'm losing track. We're blowing together, and that was with Colchester and Wethersfield, where we took back our findings to stakeholders for validation, having already validated our findings last week in Colchester with community members and participants who've taken part in earlier community forums. And as you can see, I'm waiting for some additional data on who else attended. So it's quite a large project. So what have we actually done? Well, we did a literature review quite clearly. I mean, we had to do that, start putting the project together, and we've updated and done a larger one. Policy review. Policy is my thing. For those who don't know me, I'm a social policy person with health policy as a major focus. We've undertaken public health infrastructure mapping. At the moment, that's like playing whack-a-mole because everything's changing, with ICS changes. People have got a job, then they haven't got a job, then we don't quite know what's happening. I've mentioned the walking interviews already. The community forums. Oh, I should have updated that, sorry, from 6 to 8, because I've recycled the slide, apologise, and the stakeholder events. We've done the deep dive session with harder to reach populations. Now, for example, Romanians in some sites, because people who were our EU group, because people were working long hours, it was really quite difficult to get hold of them. So then it was like doing an evening or weekend sessions. Syrians, we've had some additional deep dive. Hong Kongers took us a while to build up relationships with them, but now we've got a really good relationship and people return. But we wanted to hear about their very different experiences through coming in as British nationals overseas who are unable to have recourse to any public funds, which can be quite challenging. And it also, for example, has led to situations where someone who took part in one of our sessions was suffering really quite obvious and severe mental health challenges, really deep depression, and she felt that she wasn't allowed to access mental health services, or that she would be in breach of her visa. Afghans, very different for people who are in urban settings in London. And interestingly, we've noticed, for example, that women, younger women might have more freedom in urban settings. In contrast, where we've done a deep dive in a rural location, where people were relocated to an RAF site, we found the women were even more isolated. Very few of them did not drive, a couple of buses a day. And as a result of our direct intervention, thanks very much to a colleague who lived close to her, and our translators, we discovered one lady, for example, with really major gynecological problems. She hadn't been able to access a GP because she hadn't got enough English to actually ask for a translator through the app. And we were able to intervene, and she was taken to hospital a few days after the community forum. But we only found out about that because it was a female-only deep dive with a female Afghan translator. We've had particular themed community forums on food, accommodation, health services, and then obviously we've been undertaking interviews with stakeholders. And as I said, at the moment we're doing ongoing validation. And then I mentioned the one-to-one interviews with Wethersfield. Co-design sessions for exhibition selection. That's currently ongoing because we will be having exhibitions of the artefacts created by our community participants. I mentioned the workshops, and these are, you can see there on the right, range of methods that we've undertaken: storytelling, theatre, music, and making, cooking. The guys from Wethersfield were delighted to come out with us to ARU Little, because then it was actually, it was rural, it's an agricultural college, and we heard a lot about food. We heard a lot about their experiences of travelling and cooking as well, which was really important, their understanding of nutrition. We've also created an interactive map, which hopefully is the next slide. There you go. And that's where we've gathered information from people about services. Now, version 1 is what we call over the radar. So what we've been able to identify through desk mapping and people sending information. And version 2 is the stakeholder and community members are saying, well, actually, we use this, and it might not have already appeared on the map. It might be something we didn't know about or stakeholders didn't know about. One of the things that we're finding as a challenge, though, is in fact keeping it up to date, because someone's emailed today to go, hang on, I've just looked at the map and this and this is now closed through lack of funding, or this new one is opening up. So we don't quite know what we're going to do with that. We're going to be putting out a plea asking if there might be some interest in keeping the map going after this project ends through ICSs or other partners. And so then we're starting to turn into the knowledge exchange at the moment, identifying good practice in mapping and saying, well, what can be used, what can perhaps transfer from different sites. Now, it's very different in a rural site or an urban site. But we're starting to do that piece of work and identify, what other local areas might feel we could do this. We could really build upon this and use this good practice model. And you can see there's just some of our exercises. You can see that there's images. Okay, what comes next? Well, validation of findings. I talked about. We're doing that. We've undertaken 4 to date in the east of England. The collaborative identification of best practice, and that's ongoing. So we've come across some fabulous things such as community pantries, one-stop shop where you can get your blood pressure checked, you can talk to a nurse, you've got someone who can interpret while they're there, and also you could be signposted to legal advice as a lawyer dropped in. From that, we're then, once we've agreed the best practice examples, we're going to be doing economic evaluation. We have roped in our we have an economics professor at ARU, who's awfully good, done a lot of community work, and he's going to be doing mapping, and then knowledge exchange. And so it's going to depend what we're doing by local areas. The exhibitions of the artifacts, so things people have created during the creative sessions, will then take place. So we can't have those in each field sites. It's just too resource intensive. So we'll have one for Norfolk, one for Suffolk, one for Cambridgeshire and Peterborough, one for Essex, and one large central one in London. But we hope to maybe do an online version that can then be moved around more easily. And we will have an end of project event taking place late January next year. We're now moving into dissemination and engagement. So, for example, we're starting to set up meetings with APPGs or party parliamentary groups to share information. And we are, of course, still, doing that really deep dive analysis. So someone said, I want to know all about the experiences of Afghan asylum seekers and refugees in each of the field sites. We're starting to do that cross mapping. And then finally, as I've said, the political context has really changed. And it's a bit of a wild card knowing what's going to happen with devolution and the organisation. That's more about projects if you want to follow or get in touch. And that's me.